Hi everyone, my name is Taylor Green. I'm one of the audiologists here at Audiology Associates. So we've had this patient come in to see me for wax removal. You can see when we're looking inside this ear, we have got a full blockage, but you can see straight away we've got very thick, dense, long cilia, which is basically hair in the ear. The problem we do get with this hair, as you can see from the video, vision is not the best. It blocks our view, it gets in the way. If the patient's used a lot of oil, this can also get on the camera as well. So we're gonna need to work really slow in this ear canal. It's quite interesting to show you guys the more difficult cases as well that we do get, like this particular case. Again, vision is the most important part really. We need to see what we're doing. Now we can see what we're doing. I can just see that dark plug just behind this hair. We get the standard size ulnar tube and we're just pulling slowly. I'm hoping this is going to be the whole plug, and I can already tell there's only a little piece that's just come away from the top. So we're going to have some remaining wax there. So we're going to take another look behind. With these particular cases in clinic, when there's a lot of hair in the ear canal, if we can help it, we try to avoid using oil for that reason that we mentioned at the start. Taking a look afterwards, just the oil just tends to block up the camera straight away. So there's another big plug you can see we've just removed here. This is actually coming out really nicely for us so far. Again, a lot of hair, like loose hair that you can kind of see mixed up in amongst these plugs. Now this will just be from the patient's previous haircut. Now I'm not sure if you could kind of tell then, this patient does actually trim their ears as well, just on the tragus, which is this sort of part here. You can see very, like almost like stumps of hair where they've actually trimmed them themselves. So you can see this kind of just pushes further in and gets mixed in amongst all this wax. Now we're just trying to clear up these last little bits here. Get as much as we possibly can, get a good look behind. Again, we're trying to get around all this hair. Now yeah, you could see here, nice and clear, we've managed to remove this blockage. Eardrum looking nice and healthy. Now this is the patient's other ear, exactly the same story this side. Long hairs, dark, soft wax we can see here. So we're going to go straight in with the standard size ulnar tube again. Nice and slow. And we're listening for, you don't see it on the videos, but we're listening for the suction tube getting that grip on the wax. If you've not had microsuction before, because of the suction, it almost kind of sounds windy in the ear canal, is the only way I can kind of describe it. Now, when we get a suction grip onto the wax, as you can probably imagine, the sound gets very quiet and it kind of completely goes. So that's what we're looking for. We're listening out for that suction tube to get a good grip on this plug, and we're just gently giving this a wiggle. And I'm hoping we get this all in one go, because I can see the whole plug is starting to move here. Sometimes this cilia can hold wax in place and it can be quite difficult to remove, but we are getting quite lucky with this particular case. Here we go. Wiggle, wiggle, come on. Here we go. Okay, just underneath I can see this is one large plug, so I do believe we get all this in one go. Just gonna take another look behind. Excellent, yeah, there we go, nice and clear. So again, eardrum looking nice and healthy there. Little tiny bits of dead skin here that we're just going to pop back in now just to clear up. Again, nice and slow. This is right on the ear canal, so we don't want to cause any discomfort for the patient. There we go, come away quite nicely there. Excellent, there we go. Perfect. So, this is what we've removed. So we've removed about an inch there of these wax plugs, about just over 2.5 centimeters. Well, thank you very much for watching the video, guys. Keep liking the page, keep sharing us around. We really do appreciate it, and we'll try and catch all your comments as well. Thank you very much. I shall see you on the next one.